Hello, today on a special What's That About, we are excited to talk to Nomita Ganguly, a candidate for the 24th Middlesex House District, where she's challenging the sitting rep, David Rogers. Welcome to the show.
Thank you so much for having me.
Can you tell us a little bit about your background? I know you've been involved in state government and lobbying for like senior health nonprofits. What made you decide to run for State House this year in particular?
So I have been, like you said, I've been a legislative advocate for older adult nonprofits for the last 20 years. I've been helping them navigate the legislative system. I've also been a very active member in my community. I had kids who went through the Belmont public schools, and I have done a lot of volunteering in the schools, been very active in my community. And I'm running because I want to see change in the legislature, in particular in the House. I've been watching it up close for more than 2 decades. I also worked at the State House for 5 years in the late 90s, and I feel like we're at a time now where people are interested in change. I definitely think we need change. I think we need some new faces at the State House in order to make that change. And I think it's just really hard for underrepresented voices to be heard and for the public to have any input into the process. So yeah, I'd love to see some new voices and some at the State House, and that's why I wanted to run.
Okay. Can we stay on that for a second? When you say you'd like to see change in the State House, what first comes to mind when you think of change? What needs to change?
So I am concerned about the consolidation of power in the leadership, and in particular in the House. So I worked on the House side, and I worked on the Senate side, and in understanding how that works, I was able to become a legislative advocate on behalf of nonprofits and working on older adult issues, mostly on behalf of low-income older adults. And I have found that it has gotten increasingly harder for the public to have any input into the process. It is harder to have voices heard. It's harder for legislation to get passed. A lot of legislation and budget activity happens behind closed doors. I would love to see there being more advocacy, more input. I'll just give you one example. When about 20 years ago, or even when I was working at the State House, there used to be a budget process that lasted 5 days, lots of advocacy, lots of debate, speeches. As an advocate, you could talk to legislators, you could get support for issues, for amendments, and during the amendment process it would be a back and forth, and if you got a lot of support, you could have a chance at getting your amendment passed. And now it was, in this past budget, it was 3 days, they were done by Wednesday, 1,700 amendments were decided behind closed doors with very little activity from the public, very little that the public could impact and advocates could impact, and it was all done. And I feel like every session is a little bit more like that, and there's less efficiency as far as bills getting passed. I would love to see it. I think the stipend issue would really help. I know there was supposed to be stipend reform, but I think that would really help. I think the fact that we have no term limits for the leaders in the legislature is a problem. I think, there's a lot that can be done to make it a more accessible place for the public and for the public to have more access to the process.
Okay. Yeah, you're really, I'm a member of the Cambridge Committee for Transparency and Accountability, I think you know, and you're really kind of hitting some of our key points there. We held forums for every single competitive state district except for the 24th Middlesex. And because Dave Rogers did not agree to meet in a forum, he's the only, including Will Brownsberger and Marjorie Deckery, every every incumbent agreed to a forum except for Dave Rogers. So in that spirit of I do really believe in the need for more transparency and accountability. Here's something we would have asked if we had had that forum. We would have, and I mean, you've hit a lot of the key points already, but there is a supermajority of Democrats on Beacon Hill, deep blue, Massachusetts state. However, the state legislators routinely among the least transparent, rated the least transparent, least efficient in the country in passing bills, and often declines to pass or even vote on some seemingly progressive popular bills like Medicare for All, some key environmental reforms. And the opacity of Beacon Hill made it difficult to even determine why these bills don't come up. And are there other specific changes that you'd like to see in how it functions? I mean, how do you feel about, and you told me how you feel about the status quo, but are there any other changes that you think that would improve the functioning of Beacon Hill?
Yeah, well, thank you for inviting me to participate in the forum. I was really interested to do that. I know I got back to you right away, and I did attend one of the forums. I thought it was really, really good, and I like that it's a topic of a forum, and I think it's extremely important. I think it impacts all of the legislation that's coming up. I think this is why a lot of these progressive issues are reintroduced session after session after session, and people always say it's a slog to get legislation passed. I have found the same thing representing nonprofits. It takes a long, long time, and I understand a deliberative process, but there are some bills that I've been working on for over a decade that are good bills that would really improve people's lives. I think there's a lot that can be done to make it a more accessible place. I think part of it is, for me, what started my journey here is at the end of the last session, sort of indicative of what you were saying, at the end of the 2024 formal session, which it was quite disastrous, and there were all these conference committees out and they were creating new conference committees at 11:30 at night on the last night of the session, and all these huge bills that impact lots of peoples in different municipalities and all different areas were not resolved by the end of the session. And I thought that was a terrible way to end things, and some of them got passed eventually, but it was very hard, and a lot of the decisions were being made at the leadership level, and not even the members had much input into that. I think that it's difficult because there's a culture in the House in particular where they have it's a little bit of rewards and retribution. You get rewards for following along with the agenda, and then you maybe get a chairmanship and you get a stipend that goes along with that, and then you're sort of stuck. You have to stay in line, and it's very hard to advocate for the things that you think are important. So I would say that is one of the biggest problems with it. I think that in terms of the other thing that I wanted to talk about is the transparency bill, which is related to this. And about, I guess, 2 months ago, the House, in addressing the audit, said that they would do this transparency bill, and the transparency bill came out of a committee without any public hearing, without any public input at all, and it passed 24 hours later. There was nothing, that happened. There was all done behind closed doors. So if a transparency bill comes up, if we could have a public hearing, if we could have public participation, if people could see, how the votes were on a bill like that, if we could also see written testimony. In terms of the committee work, it's hard sometimes if you're advocating on behalf of a bill, but you don't know who has been in touch with the committee. You don't know who's submitted written testimony, maybe in opposition to your bill, or maybe you're pointing out things that they don't like about your bill. So in order to address that, it would be great to see that. So that's not something that you're able to see. So I think some of those reforms would be really helpful. I think this transparency bill doesn't help at all. I think it just scales back the audit and allows the legislature to decide what transparency is. I think the stipend reform would help. I think term limits for the leadership would help as well, just to get some new people in there, different perspectives. I don't think any of this is going to change unless we have some new voices there, and to change the culture itself.
Do you support the public records referendum?
Yes, I definitely do. I think that that's really important. I think that, and the audit, I think the audit was voted on by over 70% of the voters, and I think they want to see it done, and I think that they should go ahead and do it.
Okay. Thank you for that. Let's pull back a little bit. I've lived in Cambridge 25 years, basically. I'm not that familiar with the 24th Middlesex. It contains section North Cambridge around Alewife Brook Parkway, Belmont, and Arlington. Can you tell me a little bit about how you view this district? What makes it unique? Like, what are some of your favorite places?
Yeah, so I've lived in the 24th Middlesex district for 25 years, and I lived in Arlington for 7 years, and then we moved to Belmont, and I've lived there for 18 years. So I've been here a long time. I have a deep affection for the district. The whole district. I've spent a lot of time in it, and my kids have grown up here. And my parents even moved here as well. So, I'm deeply committed to the district and what happens here. And it is an interesting district because it has these 2 precincts in Cambridge, and then Belmont and all of Belmont, and then 6 precincts in Arlington, and all are slightly different, but I feel like there's a lot that connects everybody together. I'll just tell you, my parents, when they first came to this country, their first home in this country was in Harvard Square. So they started their journey in Cambridge, which is really nice as a starting point. But I feel like as I'm doing more door knocking and I'm getting to know the district in different ways, I realize that there are different personalities for each parts of the district, but there's also a lot that connects everybody. And I see, I have similar conversations with people in the different districts. There's people are all concerned about good schools and making sure there's school funding. There's a lot about transportation, although it may look slightly different in each of these places. Like Belmont, they're concerned about the commuter rail and, making sure that the commuter rail works for people so that they're leaving their cars at home. And how do they get to Harvard Square? And is the bus reliable? And could it be more reliable? Could it be more accessible? Could you get to Alewife? And then in Arlington, they're looking for more bus service to make sure the MBTA is more accessible. And Cambridge, I know there's a lot of discussion about the MBTA and service and access. So there's a lot that's the same. There's also housing is another one that's very, is huge in all these districts, but it looks slightly different in all of them. But I think, it's interesting to learn about, all the different areas. I've found doing door knocking has been really rewarding because you live in a district and you become really attached to, there's certain ways you interact with your district. And I was very involved in the schools, so I know a lot of what's going on there and the parents that I met. And but now I'm getting to know different parts of the district, which is really nice. and reconnecting with people that I knew before. As far as places I love, when we lived in Arlington, our kids were born when we lived in Arlington, and I spent a lot of time at Gale and Donuts. Which comes to mind. It's not in the district; it's across the street from the district. But the best muffins, and I spent a lot of time with my oldest there. And they also have Monotony Rocks Park, which is awesome. In Belmont, we have a bookstore, which is fantastic. Belmont Books, which is it's just really added to Belmont. It's been wonderful, and it has a coffee shop, and it's a great destination. And then since I've been doing more door knocking in Cambridge and meeting people in Cambridge, I've come to know the Tilda Cafe, which is super fantastic, and now I can't stay away from that place. So yeah, I have real affection for this district. It's a very important place to me.
So I'm sorry, do you have a hard out time that you need to be done by?
No.
Okay. Can you tell me, so Dave Rogers has been representing this district since 2012. Can you tell me what you bring to the table that he doesn't? Why should constituents of the 24th vote for you?
Yeah. So, like I said, I have been really concerned about the lack of efficiency and transparency at the State House. And I feel like each session it's getting slightly worse.
Mm-hmm.
So I do feel like I would be someone new, but someone who knows how to navigate the legislative system. So I have the perspective of being someone who worked at the State House inside. I know how that works. And I've also had the perspective of being an advocate. And that I feel like is really important because I've tried to get legislation passed. I've been through the process of really doing the strategy, getting people together, trying to work in coalition and trying to move things forward. And I think that perspective will be really, really helpful. I think a lot of the issues that we talk about in the district that are really important and important to people, I think a lot of it comes back to whether you have a legislator who's an advocate, who's going to advocate on behalf of your issues, the things that you find are important. I think you can have legislators who just put their name on things or just file things. And as an advocate, you have to make the thing happen. You have to move the legislation forward. So I bring that perspective and that hard work and that, and I'm hoping to, move legislation forward, knowing how to do that advocacy. I also feel like, so our current representative has been in office for 6 terms, and I feel like he's part of this, and contributing to this legislative system in the House that, consolidates the power in a few people. And I think it's impossible for him to really be in a position to make change. I don't think that he's that's really a focus for him, but I feel like it is, people are asking for that change, and I feel like there needs to be change. I think the fact that he didn't agree to a forum on transparency is pretty telling on that, and I think if we want to have change, we can't have people in there who are not talking about transparency, who are not talking about accountability, but who are really talking about these issues and want to see the legislature be more transparent. And so I think that would be a different focus for me than what, the representative that we have now. And I think we need these new voices to get new ideas and to refocus. So I also have, I think we have a lot of the same issues that we agree on, but I think I have some slightly different priorities. As I said, I've been working on older adult issues for 2 decades. And so that's a real priority for me. I feel like that issue is overlooked a lot at the legislature. There are very few legislators who are really focused on older adults. And it's a very fractured, very expensive, underregulated system. And I would love to really focus on that issue. And I think that's different. I'm very interested in healthcare as well. I think we're in a healthcare crisis, and I would really like to focus on that. And I don't think that's a priority of his. School funding is very big, and like I said, in transparency. So I think we have slightly different priorities. And like I said, I think that, the transparency issue, if we can address some of that and we can get some of these other issues that everybody cares about, it will. I also would be a full-time legislator. This would be my only job, and I would be 100% focused on doing this job and doing it to the best ability I can. I will not be focused on trying to gain a chairmanship or keep maintaining a stipend. I will be only focused on the district and the constituents. I'm not interested in those things. I'm mostly interested in being a public servant. I've also been very, very actively involved in my community for the last 2 decades, and I bring that experience with me, and the countless hours of volunteering in my school community. And I think that's different. That's a different perspective than the incumbent brings. We legislators will show up for events, but then there are those of us who are running the organizations, and I think that's slightly different as well. So I think those are, I think it's different. Some of these things are a little bit different. I do know how the legislature works. I've been an advocate for a while. I've gotten bills passed. In the last session, I had 3 bills passed. I got $6 million for Mass Councils on Aging for the last 3 budgets. So I know how this works, and I know how to get bills passed. So, but from an advocacy perspective, so.
Okay. Well, let's talk a little bit about what the legislature can do. Recently there's been 2 or 3 studies that have come out that say the biggest issue facing Massachusetts voters is that they can't afford housing, the cost of living. Studies show that the middle and lower class people are leaving the state because they can't afford to live here. Do you have proposals or any specific legislative policies that might address this problem?
Yeah, so I think about this slightly differently because of the work I've done with older adult groups.
Mm-hmm.
I do think that rent stabilization issue is a huge one. I think that I realize that it has come off as the ballot initiative, but there is legislation. There is legislation that has been filed, but it hasn't passed. So this would make sure that towns can cap, runaway rent increases that are pushing families and individuals out of their communities. I talked to a lot of people while I'm doing my door knocking who are really feeling the squeeze. And it's very, very hard. It's also for young people, for families, for older adults. And this issue was not addressed by the legislature in this session. There was the ballot initiative that was being talked about, which was rejected. And I realized that this bill is co-sponsored by my opponent, but the bill did not pass, despite lots of support from legislators, from communities, from advocates. It didn't pass this session, or in previous sessions. It hasn't been addressed. And I really feel like we need legislators who are willing to advocate on this to move it forward. There is clearly tons of support for this, and I think it's important to move it forward. And I don't know if part of that is pushback from certain industries and how that plays out, but I would say overwhelmingly people are interested in this, and I would definitely help to advocate for that if I was elected. I feel like there was a lot of talk and not a lot of action, and at this point. I do also think that, from what I've worked on as far as older adults, I feel like it's important to include older adults in this discussion, and I don't know that they always are. I talk to a lot of older adults who are really suffering with property taxes and are not sure what they should do next. Some people feel maybe they should move to a different housing situation, but they're not sure where to go. And it's very, very expensive. It's very hard to find services and supports that are affordable. So, but I think that we need to have more options for older adults, because I think not only would they maybe like to stay in their communities, but maybe they're in a space that doesn't work for them, but there isn't an affordable option for them, or affordable option that has services attached to it. But there are other options in the state that we've seen that work great for people. And so I would love to see there be more focus on that. And that will also free up housing for younger families. If there were good options, I think it would create more opportunities for other folks. I also am concerned about young adults who are trying to come back home after college, or who are trying to move into this area, and it's extremely expensive. I have young adults in my family who are, it's just really unaffordable to move into housing. So I would definitely love to find some solutions for that.
Mm-hmm. Okay, thank you for that. Let's talk about healthcare a little bit. And I understand this is kind of your what you've been focusing on the past few years. I've been running a small business the past couple of years, and one of our biggest costs is just providing healthcare, just like a decent healthcare for our employees. And I mean, I can't imagine paying for healthcare on my own. And of course, the federal government right now is not reliable. They're cutting the ACA and Medicaid. Thousands and thousands of more Massachusetts residents are going to be without health insurance. Do you have what proposals do you have to address this crisis? Do you have any thoughts on it? And what
I think this is huge. I think this is a huge crisis. I think we're already in a crisis,
Mm-hmm.
and then I think this is going to just absolutely compound the problem. So, like you said, these federal cuts, 300,000 people are coming off of Medicaid and the ACA cuts. And then there are people who are voluntarily coming off of the connector care. I think 10,000 in the early part of the year, voluntarily, because the premiums are too high. And I think, like you said, it's really scary. Healthcare insurance is very scary. And the idea of losing a job or switching jobs and not having that coverage, it's terrifying, and it shouldn't be like that. We just had the 20th anniversary of the Massachusetts ACA version, and which was wonderful, and we were getting close to universal coverage for folks. We had good connector care, we had Mass Health expansions, and so we were in a good place. But now we're not in a good place, and the uncompensated care pool is in debt now, and the fact that we're back to an uncompensated care pool is not good either. And I think there's a huge strain. These cuts and where we are already is creating a huge strain on the healthcare system, the hospitals, the community health centers. But despite all of these looming problems, the crisis that we're facing right now with the hospitals, and the premiums are so extremely high, the House didn't do any healthcare bill that would address this issue. So the legislature's gone out of session at the end of July. We knew this was coming a year ago when that federal bill was passed. And then the legislature is not due to come back into session until January. And January is when all these folks are going to come off of Mass Health, but there's no plan. I don't know what the plan is. There's no plan. There was no bill, but it is something we've known about for some time now. And I think that's that is really scary to me. And the fact that they didn't address it at all when they know that it's coming. So to me, that's a problem. I think that, what we what we need to have is better options for people. Now we know who is coming off of these off of Mass Health. There's going to be redeterminations frequently. There's work requirements. I think we need better subsidies and better subsidies and lower costs for the connector care so that more people will stay on the connector care and stay covered and will stop disenrolling. I think we have to expand the connector care to people who are a little bit higher earners so that they can see some value in joining the connector care. So, it doesn't look like a burden for them, but it looks like something that they could be on. I think a lot of people choose not to be on insurance because the premiums look too high. But if we could expand it so that more people could see the value in it, then we could also get more people into the pool and covered. As I have been saying over and over again, I worked on older adult issues, and so I am and Medicaid, and I'm very concerned about vulnerable groups and how these cuts are really going to affect people. And I think we also need groups like Healthcare for All and other consumer advocacy organizations that work with people all the time to get a little more funding to help people through the work requirements and to make sure that if they are still eligible, that they can stay on, just to make sure we keep as many people covered as possible. And then I think, prescription drug pricing is another one that needs to be addressed. Has cost a lot of money in the healthcare industry, in the healthcare system. And then, of course, I have to mention older adults. I have worked on this issue for a long time, and there are a couple of things that can definitely be done to help older adults get onto Medicaid and get community-based care through Medicaid. We've been working on it for some time, and it's, it would really help older adults stay in their homes receiving the care that they need without being too expensive. We also need to increase the asset limit to allow older adults to access those benefits. And the last thing, I think, people always ask about Medicare for All. I don't know if that's of interest, but which I do think is a great concept. Having worked with older adult groups, not everyone thinks Medicare, the program, is, covers as much stuff as it should, and this is, is an ideal program. But, the concept, I think, is there. And just to have more people covered and making it accessible to people and, high deductibles, high premiums really keeps people out of the market. And we just want to make sure that people get the care they need and are not relying on emergency care. And also just keeping our hospitals and community health centers running and not in a crisis mode. So,
yeah. Okay. Let's talk about public transportation. You mentioned it briefly. There's different Belmont, Arlington, and Cambridge kind of are covered by different parts of the MBTA. We've all lived through the disaster that occurred during the Baker government. We know there's a $25 billion backlog in maintenance for the T. My question is, how do you think we can get the state legislature to fund public transportation in a way that, to improve the public transportation, considering we've seen this coming in slow motion and then fast motion for decades? Do you have a plan to stop the legislature from kicking the can down the road every session?
I think that's what happens with everything. I feel like that, it's session after session, and then something maybe a little bit gets addressed, but this is such a big problem that addressing just a little bit each session is, 2-year session is just, it's too incremental, I think, and to make a real impact. But it definitely is something that I think constituents should absolutely reach out to their legislators to make it a priority. I think I feel like the advocacy has to be there. I know that the MBTA doesn't cover everybody in the state. It's very geographical in terms of the legislature and the legislators who are interested in it. And a lot of the legislators don't utilize the T, so they don't know the urgency for it. But I know there are coalitions for MBTA reform, and but they need more support. I think maybe they're not getting enough advocacy, enough support from their legislators. There's when I had little kids at school, I worked in Boston, and I was trying to take the commuter rail, and it didn't work for me, and I didn't. I could get to Boston, but I could never get back in time for it. There was no flexibility. There was no accessibility. It wasn't something that worked for my schedule at all. And I feel like a lot of parents are like that. And the buses don't work like that. It would take hours to get to Boston and back. And then I tried, the Red Line, and that was so unreliable. And I never got back in time for school pickup. And there was no Wi-Fi on the train. And so, it's I think I would love to see more like efficiency, more legislators focused on this in particular. I feel like there's a lot of talk about it, but I'm not sure there's a lot of action. And I know there's fair share passed, and we have funding for transportation. I think maybe it has to be looked at a little bit more carefully to make sure that it is a priority, because it seems to be that it's just the same as it was when I had little kids, and they're in college. So I think for me, it would definitely be a priority. And it does look a little bit different in each of the communities, for sure. I think the buses are a priority in Cambridge, but also, the trains it's also a huge priority. But I think we need more advocacy, and it needs to be more of a priority. And the legislators, they get a parking spot at the State House, so maybe they don't know what it's like to commute to on the Red Line.
I bet they're all sitting in traffic, though. Maybe they're not putting two and two together, but I don't think anyone can avoid it.
Right, and they don't have to pay for their parking.
That's true. Yeah. Okay. Well, let's talk about something the legislature did just do. They passed the PROTECT Act after a year and a half of Donald Trump being in office and ICE taking people off streets. The legislature finally did pass the PROTECT Act. Are you familiar with that? And are there other steps you'd like to see the state take besides the PROTECT Act, or do you think it went far enough?
So this was a huge win. I think I definitely applaud the Black and Latino Legislative Caucus for getting this over the finish line. It was hard to do, and they drafted it, they passed it, and that was terrific. I think a lot of people are maybe taking credit for it, but that legislative caucus really got this done, and I definitely applaud them for that. I guess I'm just like you said. I'm just sorry the PROTECT Act was not passed until the very last minute in the legislative session. I think it was the day before the legislature went out of formal session. But I feel like it could have been addressed. We saw what was happening in Minneapolis a year ago. Things have been happening in Massachusetts all along. It was an emergency, and I just wish it could have happened quicker. I also think that we could probably include more spaces in that should be protected. I think the councils on aging, places where there are vulnerable populations, I think could also be. I heard people say they didn't feel safe going to the Council on Aging, so a lot of older adults are staying home and they're more isolated and not getting the services they need. I think there are other areas like long-term care facilities where people are being taken care of, and so I think that there are other places. I was talking to someone about universities and public and some of our universities and state colleges, and looking at whether those places are other places where we could really protect people. So yeah, I think it can be expanded to more areas that would make more people safe. I do think that it would be great if it would have been great if the Safe Communities Act had passed. It was sort of the precursor to this, to the Protect Act, and that was filed in 2017 with lots of legislative support, and it never passed. And I know that advocates were pushing for it, and it must not have been a priority for the leadership. And now we're in an emergency and we're catching up. But if we had had that one in place, that at least would have been a good place to have protections before this all started happening, and then have the Protect Act, sort of reinforce that and expand it. But yeah, I felt like it's, again, this issue of inefficiency and accountability and acting after the fact. And I guess I sort of feel like that about healthcare too, that we're looking at this thing happening in January and there's no plan, and there was no legislation. And in this case, we could have had something that would have protected people from the get-go. So yeah,
my group, CCTA, we lobbied. One of the things we lobbied for, besides the transparency rules, committee rules, was passing the Safe Communities Act back in January 2025, and we were just given a lot of reasons why it hadn't happened. It wasn't going to happen anytime soon, and it just feels like, why?
Very short-sighted, I think.
There's always reasons why it's going to take a long time, and meanwhile, the other side isn't really waiting for us. And meanwhile, we have this crisis of everyone getting kicked off the rolls of healthcare that we know is going to happen.
Right. I think that seems to be the trend, and I think it's time for that to change. I think we have to be ahead instead of in an emergency mode all the time. I don't think it's a good way to do policy, and people are vulnerable when you don't pass the law until the end of July 2026, when you've been talking about it since or January 2025.
Is there anything else that you'd like to talk about that we haven't covered? I think we've gone through most of the questions that I had prepared.
So one other thing I wanted to just mention is a lot of people are when I meet them at the doors, or I'm talking to them and I say, are there things that are of concern to you in terms of the election? A lot of people feel like, yes, they say yes, but nothing you can do on the state level. And because I think everyone's feeling like there's so much, it's so much of a disaster on the federal level, and we're seeing cuts to science funding, and all these changes in regulation that's going to affect our waterways, and it's and nutrition programs, and people falling off of SNAP and getting and kids falling off of SNAP, and healthcare, and all this constant disaster we're hearing from the federal level. And I think people feel like there's nothing we can do, and which is, I also sometimes feel like there's nothing we can do, but I think there are things we can do on the state level. And I just want to make sure people know that there are people who want to do. I am partially running because I want to do stuff on the state level that will help us with the impacts that we're getting from the federal level. We should be doing, programs to help, nutrition programs to help people who are falling off of SNAP. We need to do stuff on the state level to be a leader in healthcare again, like we were before. Figure out what to do and how to cover people, and and how do we provide funding for science? How do we make sure that our waterways are protected on the state level? And so now it feels like there is a lot of really important stuff that can be done on the state level, and you do have a voice in how and an impact in what is happening now that we're feeling the impacts from the federal level on the state level, and we need to protect ourselves, and voting is important, and the people you vote in is very important, and people who you trust, who can trust to do a good job on your behalf, who will represent you and take these issues very, very seriously. And so I think voting is important. I think it's more important than ever. I don't think we can keep going with our legislature like this. Not getting ahead of things, not passing bills, not having public input. There's too much at stake right now, and we can't afford to keep going the way we are. So I think it's important, and I think people should know that they have power to help at this point through their vote, and how important that is.
All right. Well, with that call to action, don't forget, people, that the election day is September 1st, and early voting is going on now for the primary. And of course, in Massachusetts, or at least in this region, the primary is the only place that's going to be contested on state level, and the 24th especially. So thank you for coming on, Nomita Ganguly. Thanks for being our guest and sharing your views with us. And good luck on the campaign trail.
Thank you. Thank you so much. And thank you for inviting me to the forum. I'm sorry we didn't have it, but I appreciate that you were doing this. I think it's really important work, and I really do appreciate it. Thank you so much for having me.
All right. Thank you. Have a good night.